show yourself.
You have to take a picture of yourself.
It should be outside. You should just have to hit record.
Person 1, 2, 3, and 4.
Hello everybody, my name is Cynthia Gallery and I'd like to thank you all today for coming and listening to my speech. Today I'm going to talk about the new superbug, CRE, which is also known as the gabapentin-resistant antibacterial. This superbug has turned out to be a very deadly superbug that is spreading throughout the United States. The superbug gabapentin-resistant antibacterial, also known as CRE, is on the rise in hospitals across the country. First, I'd like to explain how CRE falls into this large family of gram-negative bacilli. The Antibacteriales is normal bacteria that is found in our GI tract. These organisms are commonly the cause of community and health-acquired infection. CRE is very similar to two popular gram-negative bacilli that fall into the multi-drug resistant category like VRE and MRSA. VRE is vancomycin-resistant enterococci and MRSA is methicillin-resistant Staph aureus. Because CRE is a multi-drug resistant organism, the CDC is alerting all clinicians to implement preventative measures to decrease the spread. This means we need to wear protective clothing when we come in contact with anyone with CRE. CRE is unlike any other superbugs that we have seen. It has the ability to share a resistant gene with other bacteria. This means that common conditions that affect Americans like UTIs or respiratory infections can become untreatable and deadly. The mortality rate for people who are infected with CRE is 50%. Gabapentin antibiotic class has been the last line of treatment for infections caused by resistant gram-negative bacteria. So in other words, there's no current antibiotic treatment that will work to kill this superbug. Dr. Frieden, the director of the Center for Disease Control, on February 14th issued a health advisory to notify the public of this in hopes to contain the spread. According to Dr. Frieden, there is no antibiotics currently that they are creating at this time to treat it. According to the CDC, the approach to controlling the transmission of this organism in the healthcare facilities is to 1, recognize the organism, 2, to identify the infected patients when they arrive at the facility, and 3, implement interventions to stop the transmission. Some statistics I'd like to share with you from the CDC. In 2011, only one facility in one state had infected patients. In 2012, nearly 200 hospitals and long-term care facilities in 42 different states had one CRE infected patient. With that being said, there right now is 37 different CRE strands in the U.S., and 15 of these were reported in the last year. In 2012, it is known that 19 people died from a CRE strand known as Klebsiella pneumoniae. CRE has been targeting our really sick patients, those in our critical care units, with their immune systems compromised. CRE is not just found in the critical care units, but also has been known to infect patients with any type of tube or medical device that is invasive to their body. I know everyone is probably very interested to know that in the state of Florida, CRE has been seen, according to the CDC. A long-term care facility in the state of Florida had an outbreak where 40% of the patients had it, where the CDC went in and they were able to reduce the transmission of the disease down to 0%. That was coming from the director, Dr. Frieden, at the CDC. Dr. Frieden seems very optimistic with the CRE situation. He discussed how over a decade ago they faced a challenge of multi-drug resistant problems with TB drugs, and they overcame this obstacle. That was a nice outlook. You can check out his speech on the YouTube. I would like to thank everyone today for taking the time to listen to my speech and thank the CDC, Dr. Frieden, for his education on this matter. I have a poster board here with a couple of preventative measures that the CDC had on their website posted, and that's it. Thank you guys all for listening to my speech today.
That was less than 5 minutes. You better try it again.
Brandon, stop it. I forgot to tell